And welcome to today's webinar. My name is October Bowles, and I want to thank you so much for coming today. We've got folks that are coming in now. You guys are the right on timers. You're right here on time. Some of you have been waiting in the lobby, so we really appreciate you. We're going to give folks some time to get in, just a few minutes, but I am really curious to know your location. I find it fascinating to learn about the diverse backgrounds and locations of participants in the webinar. So if you do not mind sharing, and you can put this in the public or private chat. So if you're shy, you want to ask a question, you don't want everybody to see it, go ahead and stick that into the private chat to us. We're happy to answer that. So, but you can also feel free to type in the public chat as well. Just let us know where you're from, and what your background is or discipline. Would love to get that knowledge from you. My name is October Boyles. I'm the Chief Clinical Officer and Customer Officer with ICANotes. So I've been in mental health for, I'm a little ashamed to say this because of my age, but it's almost 23 years now. So 23 years I've worked in the mental health setting. Um, and in diverse areas. So, but we've got folks here. Aaron's from Kansas City, fantastic. Alabama, New Orleans, Indiana, Baltimore. That is where ICANotes is located, is in Baltimore. We have Long Beach, Washington, Greenville, South Carolina. Jessica, you were just down the road. I am in Charlotte, North Carolina. So fantastic. We have Minnesota, and we have Emily, a psych NP from Montana. Oof. I was complaining the other day about Charlotte temperatures. I am not going to complain seeing Montana. I can only imagine. So, but it's so good to have you here. We have Utah, Brenda in private practice in San Diego. Oof, that sounds wonderful. Is it cold in San Diego right now? Is it cold there, Brenda? And then we have North Carolina. Leanna Hall, great to see you. A couple of people from North Carolina. Fantastic to have you in here. New York, oh, beautiful right now, I'm sure. Louisiana, Idaho Falls, Spartanburg, Tennessee. I was just in Gatlinburg this weekend, Lisa, and it was cold and snowy. And so California, lots of folks from North Carolina. So good to have you in here. Chicago, Illinois. We've got New Mexico, Chicago, Connecticut, PA. Oh, you guys are from everywhere. We've got LPCs, LCSWs, NPs. Fantastic to have you in here. Emily says we're warm today. 37 degrees right now is warm. Okay, I love it. I love it. Oh, and welcome from Johannesburg, South Africa. So fantastic to have you in here. Angela is a PhD student and LPC in private practice. My heart goes out to you, Angela. I just graduated, just finished up my dissertation. Those were not fun years. So I feel for you. Absolutely. I'm there for you. And if you need any resources, please do not hesitate to contact me. So Brenda said, cold for San Diego, had flooding yesterday with heavy rains. I have a friend that lives near that in Chula Vista. And so, yes, I heard that it was so, but thinking about you with the flooding for sure. All right, Jasmine, nurse practitioner from North Carolina. Fantastic to have you in here. Karen from Toronto. Great. Thank you guys so much for coming to our webinar today. We are delighted to have each one of you in here. And this is going to be a very insightful webinar. We have a wonderful speaker for you. It's really going to be focused on enhancing well-being through innovative therapeutic kind of approaches. So your presence here is definitely appreciated, and I applaud your commitment to personal and professional development by coming to webinars and learning today. Now, I want to introduce our very distinguished speaker in today's session. This is Bea Sanders. Bea is an accomplished professional. She holds a bachelor's and master's degree social work from the University of Arkansas, and her educational background really reflects a deep commitment she has to the field and a passion for making a positive impact in individuals and in her community. So she's got over a decade of experience, and her work has been marked by continuous dedication and growth in her field. And so currently she is serving as a school-based therapist for a mental health community agency, and she plays a really crucial role in supporting adolescents. And so her work really encompasses individual, family, group therapy. She uses innovative therapeutic approaches. She uses EMDR and ACT and strengths-based perspectives. So as we delve into today's session, I am confident that her knowledge, you're going to get a lot of it from her and her experiences. She's going to offer some really valuable insights that will help us all in our practices. So once again, thank you all for being here today. Thank you for sharing who you are and where you are. And without further ado, I want to go ahead and invite Bea to share her expertise. Thank you so much, Bea.
Thank you, October. You are always so wonderful for my ego. Thank you for such a warm introduction. I appreciate that.
You deserve it.
So, hi, everyone. As October said, my name is Bea Sanders. I'm coming at you from Northwest Arkansas, and I'm a child and adolescent therapist at a high school. So I'm in community mental health and school-based. I think I was the only Arkansan in the chat. So obviously working with high school students, ADHD is a huge component of what I do. And I was sharing with October before we went online of just like how it's one of my favorite things to talk about. Obviously a lot of my kids can struggle with it. I also have ADHD. I'm also a parent of a child with ADHD. I saw someone else share that in the chat. So it's just something that I'm really passionate about, something that I think a lot of times gets left to the wayside when we talk about therapy, especially with the teens, when a lot of other stuff can, be going alongside with that. But I also host a weekly group of group therapy with teen girls that have ADHD. And I actually told them about this webinar and asked them if they had any awesome resources that have been helpful. So you're going to be getting some of them straight from the source, straight from the youths themselves. And yeah, I think most of the time when I tell therapists I run a ADHD group at a high school, their eyes get a little bit wide, but we really have so much fun and we do a lot of really good work. They call themselves the squirrely girlies. That's what they refer to themselves as, which I love. We get nice and distracted together. And in our last group, I shared something that I had heard on the morning radio about squirrels and the nuts that they hide. And I don't know if you guys know this, but of all of the nuts that squirrels hide, they only find about 20% of them, which was a lot lower than I had anticipated. But while that might be frustrating for the squirrels, it is absolutely good for our environment, right? Because all of those unfound nuts turn into trees. And so we talked a lot about like how ADHD can, be a superpower. That's a big thing that I try to talk with the kids about, that our brains aren't broken. They just work in a different way. And we have to find different strategies to make those things work. But, while there may be characteristics that can be frustrating day to day, they also present a lot of opportunity. A lot of kids can have difficulty like with focus and distraction, but they're really creative. They may hate small talk, but they may be able to connect with people really quickly. And so I really appreciated that conversation in the group. And I usually allow them to come up with like a question of the week. And after we had this discussion, I really liked their question. So I'd like to use that as an icebreaker. So their question was, if you had a pet squirrel, what would you name it? Pet squirrel, what would you name it? I also allowed them to vote. The one they voted for was Senior McSquirlington III, which I thought was really creative. Any squirrel pet names that you would have? Rita, I like that. One of them said potato. Hey, that was almost voted the winner, but not. Taylor Swift, yes. Charlie, Ziggy. Now I'm trying to think of a Taylor Swift themed squirrel name. Nutty Buddy. That's cute. I like that. SQ, cool. Nugget, aw, that'd be cute. Bob, classic. Mia, I love the human names. I love when animals have human names. That's okay, Cammy. You can name your squirrel if you want. Pistachio, good. Ooh, Evermore. That's a good T Swift. Rocco, the Nutty Professor. Okay, that might be my favorite so far. Mickey, Nippy, Neil Patrick, respect. Chauncey, very royal. Only with the exclamation mark. I agree. Stephen, that's a good one. Awesome. Oh man, there's some really good ones. I don't know. Nutty Professor might be my favorite. Cheeks. Oh, that would be cute too. Awesome. All right. Well, feel free to drop any more ideas in the chat if you come up. I know it's some people were saying I'm not creative for this. If it hits you, let me know. Speedy, that's awesome. All right, so let's talk about our agenda and what we're going to be talking about today. So first, we're just going to do a brief overview of ADHD in kids and adolescents. And we're going to talk about what the research shows is helpful in terms of intervention and approach. We're going to briefly cover that. And then we are going to talk about some digital resources that you can implement with your kids in 5 general areas based on the research of what is the most helpful in terms of what we focus on. So that's medication intervention, behavioral therapy strategies, lifestyle adjustments, parent training, and academic interventions. So in each one of these areas, I'm going to be giving you guys some digital resources that you can implement. And I think this is particularly helpful with ADHD kiddos because they're on the internet, right? Gen Z lives on the internet and we like new, novel, stimulating, and exciting things. And I think it can be a really good opportunity to help be engaging in the therapy room, especially when, you know, some of these things can be difficult to focus on. So that's what that's going to look like. So as far as the numbers, estimated 11% of children in America are diagnosed with ADHD. And of course, we know a lot of kids go undiagnosed, right? And sometimes it can, you know, things like anxiety can sort of take the forefront. Those diagnoses can be missed. Children with ADHD, they have issues with executive functioning, right? And so this presents in all sorts of different ways. You know, kids with ADHD is not a learning disorder, it's a doing disorder, but oftentimes it can co-occur with delays in language, motor skills, social development. And so a lot of times with those pretty significant cases, we tend to see those early on in the school. And, you know, in an ideal universe, are getting those early intervention strategies started. They also tend to have a low frustration tolerance, a difficulty controlling their emotions, mood swings. So I actually listened to a really awesome podcast once that talked about, you know, when the psychology community was really studying ADHD and, you know, implementing this in our DSM and coming up with these diagnostic criteria, that oftentimes the focus on like why we identified the symptoms that we do is because they're very tangible, easy things to measure. So it's a little bit more difficult to say, do you think that you're more irritable than other people versus is so-and-so, you know, submitting 50% of their homework on time? So a lot of times we tend to focus on these very tangible dysfunctions without really recognizing all of the different ways that ADHD can impact us and impact our relationships, our ability to cope with things. And especially, you know, when kids present with other issues on top of that, like depression or anxiety, we know that ADHD can really exacerbate those symptoms. You know, if you already have depression and you're already struggling with like not feeling good enough, and then you know, you're not able to remember to grab your ID every morning, like obviously that is going to impact those symptoms, right? And I think especially when they do have a lot of struggles in other areas going on, that can be missed, and we can focus a lot on on the depression or the anxiety without really looking at that ADHD piece. So the research shows two main things with ADHD. Like most mental health conditions, early intervention is best. We know that if we don't intervene early, that kids with ADHD have an increased risk of developing struggles in adolescence and adulthood. That can look like substance abuse, risky behaviors, academic delays, social issues. So the earlier that we can intervene, the better. Especially, adolescent girls, they tend to struggle more with eating disorders. Adolescent boys tend to struggle more with like oppositional defiance disorder. So the earlier we're able to intervene and kind of help them learn to cope with ADHD and come up with those positive strategies, the better. And the second thing is that ADHD really requires a multidisciplinary approach. It is not something that we can just take care of in the therapy room. We need to have strategies that are in academics. We need to have, medical interventions. We need to have parent interventions and family interventions and those individual interventions. But all of the research shows when everyone is working together for the kiddos, that is the most helpful intervention that we can do. That so much of it requires a lot of work from their support networks as well. And I know that can be challenging. So we've got some really good resources to help you with that as well. So like we kind of mentioned, and in the next slide, we're going to talk about what those areas are. There are some areas that we've seen have been pretty helpful. The primary one is behavioral intervention. So because a lot of those, executive dysfunctions cause stress, anxiety, difficulty kind of maintaining or functioning in the school setting, it's really helpful and important to come up with different ways just to help kids work with their ADHD, to understand it and to know how to respond to it. So again, these are going to be the 5 categories: medical care and intervention, behavioral therapy interventions, lifestyle adjustments and supports, parent training, and academic intervention. So the first one is medical care, and I saw that there were a few people here that are likely prescribers, but if you're like me and you're not a prescriber, I know it can be challenging to talk with families and kids about medical interventions without getting outside of your scope. And in my conversations with a lot of therapists, when I'm providing supervision, I think a lot of times they feel so afraid of working outside of their scope that they don't bring up a lot of these things, or they just say, hey, talk with your doctor about it. But these are definitely things that we can help within the therapy room inside of our scope. So the first resource that I have listed here is probably one of my most frequently used ones, and it's just a complete guide to ADHD medications. A lot of times, when you're making that referral and you think, I think this could be helpful, maybe you should talk to your PCP or one of our psychiatrists. They may have a lot of questions that you don't feel comfortable answering, or they may need their own psychoeducation. So this is something that you can pass on to parents. But this is also something that you can utilize yourself. A lot of times they are coming in and struggling with side effects and things like that. And if we don't understand that these can be side effects of certain medications, we're not really able to help or intervene in the best way. I think there's a lot of things like, so a lot of parents, they're open to medication, but they, are a little bit leery about stimulant medication. And so you could direct them to this resource and say, well, there are non-stimulant medications available. You can read about those here and talk about those with the doctor. A lot of parents, in my experience, don't know that. They just sort of think that, it's things like Adderall and Ritalin and that there's no other options. So I think this can be a really helpful resource. And with the kids, I think it can also be helpful for them to have a good understanding of the medication that they take. Again, that's going to help them respond to those side effects when they do come up. So depending on, how old they are and how interested they are, you can also utilize this in working with them as well, right? I know I've had sometimes they've come in and, said I'm having a lot of headaches. Well, maybe that's a side effect of your medication. Let's look it up. And you can talk about it with the doctor when you visit them again. So there are a lot of barriers with medication. And so I included some helpful resources to help with those. But of course, there's a lot of stigma surrounding the medications, especially with ADHD medications. There's a lot of misinformation out there. I think a lot of the kids kind of express this feeling of like, I just want to be able to do it myself. I don't want to have to depend on medication to help. That's very valid. And so that's definitely something to process through in the therapy room when we talk about risk and benefits and, what level of support those kids need. There's concerns about side effects. The side effects can be rough. You guys know that. They say don't make any changes within the first week if you can. And that's because there's a lot of like emotional dysregulation and physical impacts of that. So that's definitely a barrier. I've had a lot of kids start medications and get off them very quickly because they didn't like the side effects and maybe they weren't aware that this was something that would stabilize over time. So that's definitely a barrier in my experience. And then the nature of ADHD symptoms. It's hard for them to remember to take their meds every day. It's hard for them to remember where they put it every day. That can be a big challenge, especially when a lot of our ADHD kids also have ADHD parents. And there can be a lot of stipulations to medications, appointments that you have to go to, and paperwork that you have to fill out. And all of those things can be really historically difficult. And so I think it's helpful just to be checking in about those things. Generally, when my patients start to take ADHD meds, one of the first questions that I'll ask is, how's it going? How is it remembering to take it every day? And if they express to me that they have difficulty with that piece alone, I think that's really important to focus on right off the bat. So it's an article here by GoodRx. They have some really good reminder apps that can be for medication. With my teenagers, a lot of times I'll say, open up your app store and type in medication reminder, type in organization, download a couple of apps and see what you like. I know that can be helpful. They kind of enjoy sort of being able to choose, but there are some really good ones listed in that article. If you need any suggestions, it can be good for parents too, to help them reinforce those behaviors. Other barriers, parental factors, skepticism about the necessity, long-term effects. They don't want their children to go on and have addiction issues and things like that. And interestingly enough, people with ADHD do have an increased risk of substance abuse. But from what we can tell, that medication, early intervention, generally helps us cope with the symptoms of ADHD so that it doesn't increase our risk of developing substance abuse with those medications. So I always try to talk with them about that. But a lot of times, like, we're at an increased risk because we're dealing with extra stress, extra anxiety, and we're trying to cope with that. But when we're able to learn how to cope with that earlier, we may not need those later on in life. And the long-term effects, that's a really valid concern. I know it can be really frustrating when we know that medication would be really helpful for a kid, but the parent is just not on board. But, when we look at a lot of what we don't know about the long-term effects and effects on our dopamine and serotonin levels, those are very valid fears and concerns. So I think it's important to explore those in family therapy as well, and to talk about those with the families, and so that we can come up with the best solutions and weigh those risks and benefits. And then there's also the financial constraints and access. These medications can be expensive. There's a nationwide Adderall shortage right now. Sometimes it can be even difficult to find the medications, or their insurance may go out for a couple of months and then they have to go through that whole process again. So there are a lot of barriers between ADHD people and getting those medication interventions or that medical interventions. And so I think that's a really, I'm sure you guys are very familiar, normal thing that we experience. So with behavioral therapy interventions, let's talk about some resources that we can use individually in the therapy room. So US Davis Health has a study here that talks about what is the most helpful for school-age children. And so they studied a lot of different interventions that people had made, and they looked at that preschool intervention. That age was the most helpful, and that it consisted of several appointments with a therapist, during which they talk about positive communication, appropriate discipline, reinforcement of good behavior, and structured environments. So I know that family therapy is not always the most favorite thing for a lot of clinicians to do, but with ADHD, it is essential. And it's I think one of the most helpful things that we can do. So it really has to be a team effort. The earliest you would want to start on meds, it's and I'm not a prescriber, so it's difficult to say. I think, generally when my kids are struggling to a level that's causing them a lot of distress, and we're trying a lot of interventions and a lot of support strategies, and we're still experiencing those same difficulties, that's when we say, hey, maybe we could use some extra support. And so in my state, I can't work with kids under 5. So I've never made, a referral, obviously, for that age, age or below, but it can be a difficult thing to know. Okay, so the first resource I've listed is my personal favorite. And I think of all the resources, this is definitely in the top 5 that I use. So How to ADHD. This is an amazing channel about ADHD that I have loved for years. I've learned a lot through it. Jessica McCabe, she has ADHD. These videos are mostly geared towards young people, but I have used them with young kids, teens, and adults. There's some really amazing ones on there. My favorite, which I should have listed this, is called The Wall of Awful. And it talks about a lot of the emotional blockers and shame that we have surrounding our ADHD and how we approach those. And I think that's probably the one that I show kids the most. But generally, they love YouTube, right? So because I don't want ADHD to go to the wayside, when we are talking about other things like depression and anxiety, a lot of times I'll offer, we could watch one at the very beginning of session and just talk about what that looks like in your life. None of them are, more than, 10 minutes long would be a long one. They're generally around 5 or so minutes. And I will let them pick it out, or I'll pick out one for them. I'll tell them I've got a lot that, I know are good if you'd like me to pick, but you could pick one if you'd like. And that has been really helpful. I think that generally each time I show someone one of those videos, they're like, wow, I didn't know that. And they're really interesting and engaging. I always try to tell them I'm not going to show you something boring because I have ADHD too. So I know it needs to be stimulating and engaging, but she is just so good. And I really encourage you guys to check her videos out. I put her channel trailer there. And I also included her favorite 10 online ADHD resources. She's got a lot of really good ones as well. So definitely she's got support communities on Facebook and all sorts of stuff. So definitely check out Jessica McCabe. She's amazing. AI, obviously, this is a new one for us, right? But I've been utilizing this a lot in the last year, especially working with teens. They love AI. So I encourage them to look at AI as an ADHD assistant. So, a lot of times they'll come in with certain issues and I'll say, well, let's ask AI and see what they think. So if you think about executive functioning, organization, prioritization, task initiation, these are all things that can have functional impairments. So if they come in and say, for example, I keep losing I can't remember to bring my student ID in the mornings. The mornings are just so crazy to me. I'll say, well, let's ask AI. What would be some things to help me remember to bring my school ID in the mornings when I'm tired or I'm, don't have very much time to get ready, and just talking about different, possible things that we could implement there. I had someone come in talking about their ADHD medication gave them really bad dry mouth. And so I was like, let's ask AI. What can I do to help with dry mouth? There's dry mouth sprays, apparently. There's dry mouth cough drops, apparently. So, we came up with some strategies with that. So I know a lot of people may not be able to or may not be very familiar with AI, but if you like look at like ChatGPT or different apps like that, they can be really fun to play around with and to kind of bring them in on that problem solving, because problem solving is an executive functioning skill that in particular ADHDers tend to struggle with, right? Brain breaks. I don't know if you guys are very familiar with this. So brain breaks, I learned with them first studying conscious discipline. I don't know if you guys are very aware of conscious discipline. She's great, by the way. Becky Bailey, amazing. So ADHD people, we need novel, stimulating, exciting, engaging. A lot of times with like 504 accommodations and things like that, we tend to like want to tack on a lot of extra time for ADHD folks, when really that's like kind of the last thing we need. We need that like high intense work with like very frequent breaks. So brain breaks are just like little quick breaks that kids can do, and adults, to sort of help refocus. I like to utilize this in the therapy room when I see their focus is waning. I love to teach teachers about these so that they can use them in the classrooms. I love to work these into 504 plans if we can. We do them in group therapy when they're getting a little out of control. So it can be things like bear, salmon, mosquito. I don't know if you've ever heard of that. Kind of like rock, paper, scissors, but bear eats the salmon, salmon eats the mosquito eats the bear. And, starting back by back, let's do a quick brain break. And you go 1, 2, 3 and turn around and see who wins, right? A quick brain break, doing jumping jacks. There's lots of really awesome ones out there. So I've included 2 lists here that are have amazing brain breaks in them. A lot of times in my first couple of sessions, I'll ask them, like I'll suggest a couple of them and see any of these sound fun for you. And they generally really like the brain breaks, and especially with telehealth, I think that can be helpful too, because it can be particularly difficult to engage them in that. And I do have some resources for that one as well. Okay, executive skills training. Again, ADHD folks struggle with executive dysfunction. So a lot of it is just finding ways to help manage those dysfunctions. So I know child and family therapists, we have some different ideas about like implementing games and things like that in the therapy room. Me personally, I just think that there's so many different things out there that we can find a way to have fun, engaging time in a way that's still focused on what we're here to treat, right? So especially when working with younger kids, sitting there for 50 minutes is pretty difficult. So, I might offer to them, we can play a game the first 10 minutes or the last 10 minutes a session. Which one would you prefer? That puts them in control, right? And generally, I pick out some games, like some that I'm going to cover with you here, that are still sort of focused on that ADHD treatment. And they generally like them. And so one of the ones that I have here is The Sims Free Play. I'm sure a lot of you are familiar with The Sims. The Sims is all about executive functioning, right? We're feeding our sim, we're meeting their needs, we're, setting them up with the things that they need to be able to function in their universe. And so if we do have to play a game or something like that, I try to do something that is still going to be productive and fun. So The Sims is great. The I2I Empower app. So this was one of the ones that the kids referred to me. So I have not downloaded this personally, but they said it was really fun. It's got quests that are all like rooted in like strengths and in challenges. And it comes up with like a self-advocacy plan at the end, which I think is really cool. Those are some, different options. And then I included an article about minimal supply activities to help with telehealth. So I know in the beginning of the pandemic, I was almost completely telehealth. There's been lots of times when we had not expected it that we've had to do this. And I remember just like in the beginning, how difficult it was to keep ADHD kids engaged on that telehealth setting. So, and we need more engagement, we need more stimulation. And so this article has some really good activities that don't take a lot of prep work, that don't cost a lot that you can utilize to help kind of engage them, which I think is really helpful as well. Lifestyle intervention. So this is one of the biggest focus areas, I think, or the most high return focus areas, I think. So sleep, physical activity, and diet. Those are the big major three ones. If you look here at the bottom of the list, there's a podcast that I really encourage you guys to listen to. It's called Lifestyle Changes with the Biggest Impact on Kids with ADHD. And they really cover how important this lifestyle piece is. A lot of times it's like, maybe kiddo struggles to get up in the morning and it's like, that's just something about Billy, he just can't get up in the morning without really trying to find strategies to help him be able to cope with that symptom, right? So there's a really good article here from Attitude Mag, lots of stuff in here from Attitude Mag. They're amazing. And it's all about just different issues that ADHD kids can have with sleep and interventions that help, things that families can do to help. Physical activity. I love this article. It talks about like what sorts of exercises ADHD kids really tend to gravitate towards. One of the things mentioned in there that I had never thought about before, but made total sense was things like group activities or like personal trainers where other people are like, you're sort of accountable to other people. Those help kids stay consistent and engaged, so like team sports, right? And things like that. And it also talks about how in a lot of studies, they did high intensity cardio for at least 30 minutes a day, 3 to 4 days out of the week, and that it showed positive impacts on par with medication. So I think that that's a really helpful thing to be checking in on and helping kids find ways to move their bodies that feel good and fun and relaxing to them, but also help them focus. And then the diet. So this is a really just a guide to ADHD and eating. And, I'm assuming most of us are probably not nutritionists or dietitians, but a few things with ADHD kids is that they need lots of protein and they need to eat really frequently. And, I think it can be helpful to be checking in, especially when they might have side effects from medications that make that difficult. They might not have a good appetite. They might go all day forgetting to eat. So we want to be checking in with that as well. There's, and I struggle to remember her name, but there's a woman that wrote a book that's like how to clean your house when you're drowning. And she's a therapist that does ADHD cleaning stuff. And she talked about with her neurodivergent kids, like they eat dinner directly after school and they get an hour of decompression time and then they snack throughout the night. And that was what was most helpful for them. So a lot of things that we just don't think about that can impact them all day long. Also, we've got a really good article here about leveraging those things with treating ADHD called Beyond Genes. That's a really good one. Academic intervention. So this can be another one of those things that I think therapists can feel a little out of scope when they're working with kids that have ADHD, but we have a tremendous opportunity to work with school staff and to work with families and helping them work with school staff to support our ADHD kids. So the biggest thing is 504. I don't know if most of you guys go to 504 meetings. I go to 504 meetings all the time. And I think that those are so helpful because when we're talking about that team approach, everybody's there, the teacher, the principal, the parent, the patient. And so I think we have a really tremendous opportunity to both help our kids, but also advocate for them with the things that they need. So I think I mentioned extended time earlier. That tends to be one of the ones they give ADHD kids, even though extended time generally isn't as helpful as having lots of breaks with short spurts of work. So these articles here, there's 2 articles in a card. They have some really good accommodations listed. I like to have a family therapy session or an individual therapy session, just depending, and talk about, we have this meeting come up. What would be some real tangible things we could do to help support you in the school system? Do you need frequent bathroom breaks? Do you need to sit at the front of the class? Like, do you need extra check-ins? Really involving them, creating that person-centered approach, I think is awesome. And I love this downloadable card. And I think I've implemented this in a few different ways, like either making it myself or using this one. Beyond Jean's doc, we need to access it since it's a Google Doc. Can it be? Yeah, I think we can send that as a PDF. Don't know if October Angela's in there. So how can you attend 504 plans? I'm in the school setting, so I just like know the folks in there. They tend to work with me. But generally, if your families are saying they have a 504 and they have meetings, you can say, please invite me to those meetings. And most of the ones these days are on telehealth. So even if you're not in the school setting, it's more manageable. And they always want me there. Like, they always want the therapist to be involved. So you could, have the parents reach out or get a release and reach out to the school staff if they're comfortable with that. So those are all different things that we can do. But with the cards, I also like to, when we're coming up with that list, if the parent has a card or the kid has a card, something handy, visual, because ADHD kids love visual, to help them remember so that they can advocate for themselves in the session, or their families, or you can help advocate for them. I think that can be really positive. It can be intimidating in a 504 meeting. There's lots of people with lots of testing information and lots of things to say. And so I just find it really helpful to have like a quick referenceable, well, this is what we talked about, and this is what we thought could be an option. There are also some really great kits I've included. A summer success kit for kids. So, ADHD kids, we thrive on routine. And so there's things like summer break and snow days and Christmas break and spring break and all of these things that tend to really throw kids off. And I think it's helpful to plan ahead for these things and talk with the families about how we can support them in that new, less structured environment. So that's good. Big list of ADHD school resources from Attitude. That's a really good one. I've definitely sent that to a couple of my teachers. Might also be helpful to think about just digital apps that can be helpful for organizing. And over here in Arkansas, I don't know what it's like in other parts of the country, but they really use Google for everything. They've got Google Classroom and Google Drive and Google Calendar. Teaching the kids those programs and reinforcing them and checking in on how we can utilize these things to help us later on, I think is really good. Also, a hack I've found, a lot of these self-care apps do the same thing. They've got medication reminders, they've got goal lists, they've got habit trackers. I actually don't think I listed this one, but if you guys have ever heard of the app called The Daily Bean, it's a self-care app where you take care of a bean, and you can set your own sort of goals with it. There's like a calendar where you can assign pictures so that it helps you jog your memory of what you were doing that day, which is short-term recall. We can struggle with that when we have ADHD. So that's a really good one. But I also like to bring them in on that process and say, hey, I haven't got a chance to try this one yet. Would you mind checking it out and tell me what you think? And they seem to really like that too. So another app too about time management apps that teens will actually use. Parent training. So this is a big one. And I think one of the ones that cause clinicians the most anxiety, and I understand that as well. It can be really frustrating and hard sometimes to work with parents on some of these things, especially when they themselves can struggle with it as well, speaking from experience. So the Child Mind Institute, that's probably, this is like the biggest resource guide I think that I've included with parents. So they have anything you can think of, ADHD with ADHD, autism, behavioral issues, bedwetting. I mean, any topic you can think of, they've got some really great articles, guides, webinars, resources there. Understood.org has an amazing video called Through Your Child's Eyes. I use this a lot when my parents are very burnt out. And, it's frustrating having to deal with the same behaviors. And, I think when they fall into that, well, they know better, but they're still doing this. I try to use this as a little bit of empathy building on just like what it looks like through their kids' eyes. And it tends to have a pretty positive emotional response when I show it to them. So I definitely encourage you to check that out. There's also a few other parenting guides, one with defiance and confrontation, because we know that can be an issue when kids struggle with impulse control, emotional dysregulation, social skills. Those are going to be some struggles that they have, right? A summer success kit, again, planning ahead for those more difficult times. And this Attitude Mag 100 ADHD parenting tips. So this is listed as like sort of these cute little boxes. I've printed them out and cut them out. And so I think that's really cool. If I had more time, I may do something where I emailed one of those a week to all my ADHD parents. So, I think that can be helpful as well. But especially when they're bringing up issues that I know are covered in some of those cards, I might crack some of those out and just normalize kind of what they're going through and helping them kind of come up with positive solutions. Digital resources for clinicians. So Attitude Mag has a awesome for clinicians section of resources. They've got free webinars, they've got guides, they've got articles, they've got videos. A lot of the things you have to like enter in your email to get, but they don't spam you with stuff, from my experience anyways. So lots of really good stuff there. So I know I recently had a kid with ADHD that had OCD as well. And so that was something that I was a little more unfamiliar with and actually utilized that section of the website to get more information. The Clinician's Guide to Treating Complex ADHD, love this 7-part series. They email you like 7 different emails that have just these different questions. It starts from like comprehensive treatment planning and goes through a lot of the things we're talking about today. My co-therapist and I, we had like a working lunch once a week where we would look at that. And so, it made it sort of an easy, more concise way for us to do that. Free webinars. And they also have webinars for teachers and parents too. So that's a really awesome spot. And then the National Institute for Children's Health Quality, Caring for Children with ADHD, a resource guide for clinicians. So if you click on this and you download it, it basically opens up a file of like 20 different commonly used things, billing code stuff, reimbursement stuff with ADHD, Vanderbilt assessments for the parents, for the teachers, school check-in lists, like lots of really good stuff. So I use that all the time. Definitely encourage you to check that one out. But I know since the pandemic, things have really changed for us. And I know technology is more a part of our practice than ever. And so I hope that some of these digital resources help you intervene and help come up with support strategies for kids and parents and families and their school families. I really appreciate all of you guys coming here today. I think ADHD is one of those things that there's always more to learn. It's very complex. We're learning more every day. And so I appreciate you guys taking the time and effort to attend this webinar today. And feel free to drop any questions in the box before we switch over to October. And I'm going to see, what are your thoughts on the neurophysical? I am not sure I'm very familiar with what you mean by that. Neurophysical medicine. Again, I'm not a provider, so some of these things I'm not as familiar on. Biofeedback, okay. We have some parents in here who are familiar with it.
And if I could just share a little bit. So
Sure.
this is October again. I when I had well, I say I had ADHD. I have ADHD. I don't take medication for it. But when I was younger, I was absolutely on medication. I took Ritalin, and mine was pretty severe. As imagine a little October with a lot of behavioral problems. So
Mm.
at one point, I had a teacher literally tape me in my desk. That was many, many years ago. I mean,
Wow.
there were spanking in the school, and I got a couple of those. And again, this is for folks that live in North Carolina. I lived in the country backwoods of North Carolina, and this was just so our teachers all had paddles. But I went and I had biofeedback by a woman named Myra Preston, and she practiced in the Charlotte area. And I don't know if Myra has Dr. Myra Preston. I'm not sure if she has retired yet or not. But the biofeedback that I received, and again, I will tell you my age. I'm 46. That was I had that when I was 11, and then again at age 13 or 14 truly changed my life. So I
Wow.
did want to just pop in and say that was not planned on this webinar at all to talk about that, but it was absolutely life changing for me. Now, I'm very, I'm one of those people that I believe in the research. I love the studies. I don't think that there have been enough studies to come
Mm.
to really conclusions, but I can only give my personal experience and how that went. And I did not have to take medication after that. I do,
Awesome.
and so that is just my personal experience. So I wanted to pop in and say that if anybody else has experiences in it, what I love about these webinars is we have well over 100 people in here, um, and everyone has they bring such good knowledge to the webinar. So if you've had any experiences in it, please share that in the chat, because I think it's wonderful for folks to have kind of these conversations about it as well. And definitely, if you have any questions, I want to make sure everybody has gotten their handouts. That you have gone to the top. There is a handouts tab there, and you've gotten your handouts there from that, because we want to make sure that you take some information away from that. I'm also going to show you just a very, very brief demonstration of ICANotes and what we have as far as ADHD and documentation in the program. And so I'll share my screen for just a moment here. I'll go ahead and share. It'll let me share. I think, can you stop sharing yours for just a second? I'm sorry.
Yes. Let me figure it out.
All right, excellent. Thank you so much. Thank you, thank you. All right, so I'm going to share. This is ICANotes. This is kind of our view of ICANotes. That's definitely a larger view than what we want. But this is what ICANotes looks like. I have Piper Chapman. If any of you know that name, if you want a nice binge-worthy series, it's called Orange is the New Black. Do not watch it in front of children. But these are some of the characters here. And so we're going to go into a therapist note. We have a prescriber notes, therapist notes. We have lots of forms and assessments in the program. And we do have these on ADHD. So we do have these as well, and we have them for adults and also for children. So we have a large amount of forms in here. I'm going to roll right back to the chart face though, and we are going to go into a therapy note as if I'm dealing with a patient who has ADD or ADHD, and we're going to go into patient has symptoms of. Now, at any point in the program, you can absolutely type to your heart's content, but we're not going to type right now. What we're going to do is we're going to go into ADHD. I'm going to say that unfortunately it continues and their symptoms are worse, and then I can talk about some of the things that Bea talked about, like they're having disorganization, and that is present, and they maybe fail to finish projects, and that is present, and they have of course a short attention span, and that continues, and they avoid tedious tasks, and that is continuing, and maybe like with me when I was a child, leaves their seat. So maybe fidgety and restless and talks excessively and perhaps blurts out answers and can't wait their turn and interrupts. And so all of these symptoms can be put in here, and you can absolutely type along with this as well. So as with this as well. And then I can come in and talk about maybe a little bit more about their behavior. I can go in and say, that they've had, as far as their school functioning, it's been impaired, and their anger is poorly controlled, and impulses are poorly controlled. We can talk about sleep, because I know that was a major issue with me when I was younger, is sleep. So there were sleep problems. It was falling asleep and staying asleep. And then we can go in and talk about verbal content. Maybe they're having problems at school, and maybe they're having problems and they've got the ADHD, they have maybe some anxiety going on, maybe some low self-esteem. And so we can talk about that. And then therapeutic interventions, we can go into our session goal and we can say we're working on, coping skills and self-esteem and self-control, and interventions for that, or we're supporting them, encourage them to ventilate their feelings, providing self-esteem enhancement. And then we can do counseling as well, as far as importance maybe of compliance medications, maybe stress reduction techniques. You can go in and do a mental status exam. If they're having a great day and they're doing really well, we can say that their mental status exam is normal. It puts the patient or client's name in, as well as their pronouns. If they do not use, do not use he or she, it puts they for their pronouns. And then we can even justify level of care. So we make sure we're getting reimbursement from the insurance company. We're getting those additional sessions. And so I could say outpatient is still needed because it interferes with the day-to-day activity and they're unable to self-alleviate. And we have EMDR therapy here as well, content. And then we can go in and link in our treatment plan, and you can pick from multiple treatment plans. I'm just going to throw one in here. Maybe we're working on a 0 to 10 self-report scale, and I can link that in. And then I can talk about the problems that they're doing. Like maybe they're doing really well and we're going to continue the current plan. So it takes me like 60 seconds to link in a treatment plan. It takes me about 2 to 3 minutes to do a note. And then as you can see here, I have a really robust note. I highlighted my headers. You don't have to do that. But I have a really robust note here, and then my treatment plan is linked in. And so that looks like I've been typing all day long. So that is what ICANotes can provide for you as far as making documentation very easy within the system. And we also have a robust calendar. We can send out text messages. If you're doing groups, I just want to show you really quickly for groups. If you go into therapy groups, if you have big groups, I can go in and let's do Angels Therapy Group. I can add people into the group really, really easy. I can even pull whole groups in. So we'll say that we're going to add Bob Ross in, and then I'm going to create a therapy group. Now I want to show you how our therapy groups work. They're even a little bit faster. They take all the participants of your therapy group and align him here on the middle. And you see their names and their remarks. And then everything that I put in this yellow section will go on the top of everyone's note. So as I jump into their note, I could say maybe I could talk about therapy type if I want to. So we have EMDR therapies, we have client-centered therapies, crisis intervention, 12-step DBT therapies. So I'm able to put that in. Let's say it's client-centered. And then I'm going to say it's a group therapy. And we have process groups, we have focus groups, all types of different groups in here. And maybe we're talking about self-esteem during our group. So I'll go ahead and click self-esteem in there. It will add a beautiful area there for me. And then I'll go ahead and I'm going to say we're actually, you know what? I'm going to talk about leader interventions, and I'm going to say that we kept the group focused, we involved all of the group, and we also set limits and boundaries. Now, this goes on everybody's note. So every single client I'm seeing or patient I'm seeing, doesn't matter if it's 4 or 30, that will be on everybody's notes. Nicole caught that about Bob Ross and Rick Ross from Brooklyn. Yep, you're quick on that, Nicole. Good catch there. Um, so I'm going to right, exactly. It's a good group. It's a good group. So let's say that, you know, I'll say that Piper Chapman, she was an absolute angel during group today. She was fantastic. So I'll go in and say her participation was that she was active and engaged, and her behavior was that she was sharing and supportive, and she was attentive during the group. She's absolutely wonderful, right? Now, let's say Bob Ross acted out. Let's say Bob Ross acted out. So Bob so we'll say he went in and his participation was that he was verbally aggressive and he was over talkative and hyperverbal. If you could only imagine, poor Bob is having a really bad day and he was irritable and he had poor insight and was resistant, okay, and really disruptive during today's group, okay. Now that goes on the comments for those folks. All right. And if you, this is great if you have a large group, because I've charted on Piper, I've charted on Bob, they're green, they're good to go. I could really quickly go into Mr. Krabs and say, he was normal and appropriate during group, and his behavior was that he was great. Okay. He did really, really good. He was supportive during the group. And if I was done with everyone, and let me go in for those folks that are like, you didn't get Sandy, let me go ahead and say that she was active and engaged during the group as well. I could go ahead and click this plus button, and every single one of these notes would then be filed perfectly in that patient or client's chart. So that's one of the nice features about ICANotes. If you're having to do a lot of group notes, you can do your group notes really quickly in like a minute or two. So yes, absolutely. And I love I love the comments there. And just wrapping up, Bea, I want to thank you so much for doing the webinar today. As you can tell from the comments, we got a lot of people very receptive. So I really appreciate you. And thank you all for coming today. Again, I think that individuals that take their time to learn more about things that they're already doing really speaks to the and wonderfulness and dedication that you have in your field. So I cannot thank you enough, and just appreciate you so much. And I hope everybody has a wonderful, wonderful day, and stay warm. Stay absolutely warm. Right? Thank you so much, B. Thank you.